Excellent. Thank you all for joining us tonight for our second virtual career chat. I appreciate you all taking out the time to hop on here on Zoom and join us. This will be recorded later on. So if you have any friends or if you want to come back and you think you missed something, this will be recorded and posted to our website, or just email me and I can shoot you over the link. But I think all of you do know me, but if you don't, I'm Taylor Danbury, and I am the Health Professions Coordinator with Northwest Missouri AHEC. I am here tonight with our guest host, Melissa Southard. She is a senior respiratory therapist at Mosaic Life Care. And I'm also here with our student host, Roida and Gibby. They are seniors in our ACEs program. They've been in a part of our ACEs program for 2 years now, and they have volunteered to take over our virtual career chats and host them themselves. So I'm going to let them take over from here. If you have any questions throughout the chat, or if you have to leave and come back, there is a chat box at the bottom. So feel free to just type your question in there, and I will be viewing that throughout the Zoom session and can get right back with you. But I will go ahead and hand it over to our ACEs co-host.
Hello, everyone. Thank you so much for being here. My name is Roida. I will be one of your hosts for this evening. And today we have with us Miss Melissa, who is a senior respiratory therapist. And so starting off with the first question, can you please tell us a little bit about yourself and what you do?
My name is Melissa Southard. I'm currently the clinical educator of Mosaic Life Care Respiratory Program. I've been a therapist for about 16 years, and I've been at Mosaic for 22 years. I started as a unit secretary and then decided to do more hands-on patient care. I think that's what got me into it, was just working in the hospital and wanting to do more with patients. So this is where I am, and I love what I do. So I'm happy.
That's amazing, and that's great to hear. Definitely being in that environment is a great way to find out whether you actually like something or not. So that kind of piggybacks into the next question, which was, what was your inspiration for pursuing this career, and when did you realize that this career was the one that's right for you?
So I kind of went backwards, because I went to Missouri Western and got a bachelor's degree. Right out of high school, I wanted to go to med school, but to be a pediatrician. So I got my bachelor's in biology with a chemistry minor, and started working here. I didn't really want to teach, and life kind of changed. I had my son, and so my path just kind of went backwards. And so I went back to school for respiratory and got an associate's degree, because that's kind of what life had in store, I guess. So it wasn't my original plan, but I'm glad that I did it. So that's where I started and how I got it. So I did get a bachelor's first and then an associate's degree. So that's kind of the opposite direction, but it worked out good.
Yeah, definitely. I love how you shared that, because, life doesn't always go the way we want it to. And it's important to just kind of enjoy the journey. And the fact that you actually are happy with where you are right now kind of proves that. So it kind of brings peace into knowing that, unexpected things happen and we just have to embrace it. So yeah, thank you. And then the next question I have for you is, can you share what your daily responsibilities are as a respiratory therapist?
Yep. So we work all over the hospital here at Mosaic. We do everything from basic nebulizer treatments, breathing treatments, bronchodilators that open airways, MDIs like steroids, corticosteroids. We give those on a scheduled basis. We take care of decompensating patients. So when patients decompensate, we have different oxygen devices we can use, from basic nasal cannula to high flow nasal interface, oxygen masks, BiPAP, CPAP. And then if they end up needing the ventilator, we assist the physicians with intubations. So we're at the head of the bed for all of those things. We work in ER, the NICU, the ICU, all over the place with ER, we're always in all the traumas, code blues, anything that comes in. We take care of tiny babies in the NICU when they're first born, because oxygenation is a lot of their problem. We take care of kids in the ER, which is kind of scary because kids get sick really fast. So they can compensate and take care of it until they can't, and then it's super quick. So that's kind of a scary side of the job, but it's awesome. I love patient care. I think that's what my calling is. I love working in ER and ICU. Those are my favorite things. So ventilators and BiPAPs, we draw blood gases, so we can make changes to the ventilators based on those blood gases, and things like that. Little babies, we suction, so we do a lot of snot. We can work in the bronch lab, so take a scope that goes down with the camera in their lungs and suck all that stuff out, all the snot. So it's lots of areas.
Yeah, I think that's very interesting because it seems as though you have a lot of freedom with which kinds of patients you see, from newborns up to, the elders. And so with that in mind, can you tell us about what a typical day looks like for you, as in who do you mostly deal with and who do you mostly treat?
Yeah. So before I did education, we have resource therapists or charge therapists. So they come in a little bit earlier in the day. So we do 12-hour shifts. So you either start at 6 a.m. or 6 p.m. And so that resource therapist comes in, we have a report of all the therapies in the hospital. So we make assignments for those, all the therapists that we have. So when you come in the morning, you get your report sheets, and so you get a report from the shift before, and you find out what area you have, and you may have an entire floor with 10 therapies on it, or you might have ICU or ER. If you have ER, you have OB with the NICU and recovery room, GI lab, all those areas. And if you're the resource therapist, then you don't have an assigned load, but you're helping in all those areas. So if you have patients in ICU that are on the ventilator that are going to go down for a CT or something like that, the resource therapist usually helps transport those patients. But the normal therapist will take their load, get their report, and give those scheduled NEBs. So we do NEBs at 7:30, 11:30, and 3:30, and then 7:30 again. So you usually have 3 rounds through the day. So you do those rounds, and then in the meantime, you have all the other orders that come through. Like if a patient's decompensating on your floor, that's your patient, so you take care of that. Draw blood gases, help transport with the resource therapist if it's your patient. Sometimes they can't always do it. Sometimes patients on BiPAP are going to dialysis or all those kinds of things. So during your downtime, I guess, between the rounds, I'm sorry, these questions are popping up. So then you just do whatever other duties as assigned, I guess you should say, but it's patient assessment and just keeping oxygen rounds and all those kinds of things.
Yeah, I mean, it looks as though you have pretty good structure with your day, which I find really cool. And, it's something that I enjoy too. And so,
Hey, Ryder,
pardon.
before you ask the next question, what does decompensating mean?
So if a patient's not doing well, say they're having trouble breathing, or so they're just not doing as well as they were originally. So they could be short of breath, or they could be having pulmonary edema, which is too much fluid, so they're not able to get that fluid off, which causes their lungs to be stiffer because there's fluid in there. All different kinds of things. Sometimes it's just their blood pressure is dropping or increasing, so it can be anything that causes the patient discomfort, or just the patient's not getting better, they're doing worse.
Okay, interesting. Thank you.
Yeah, thanks for the clarification question, Gibby. I'm sure many of us found that helpful. And so the last question I will ask you before I pass it over to Gibby is, what is the biggest challenge that you've faced in your career?
Definitely COVID. So we had a lot of therapists that left during COVID because they would travel around, and but patients were definitely the sickest that we've ever seen, because normal methods of treatment, normal oxygen devices that we would use on patients didn't work with COVID patients. So we had to think outside the box and do a lot of like proning patients, so putting them on their stomach because that helps their tissues get more oxygen, which is not something we normally do. So lots of BiPAP, lots of CPAP, lots of high flow nasal interfaces. And those patients were alone. They weren't, like, their families weren't allowed in. So they needed a support system, and that's what we were, because that's all that they had. So that's definitely the biggest challenge. But I mean, it changed us as therapists, really. I think we worked better as a team. I think every caregiver probably had PTSD from it, just because those patients needed us so bad. And sometimes we couldn't help them. And that's what was terrible with COVID. So.
Yeah, sounds like a big challenge. I'm sure it was difficult for you during that time. I can't even imagine, how hard it must have been with all these sick patients, the families. There were tough times in general. And so the next question kind of relates to that, which I will let Gibby ask that.
Okay.
Yeah, you kind of just, you answered, kind of inadvertently answered the next question, which is, how has your career changed in response to COVID-19? But if there's more that you'd like to add, go ahead. But you kind of just answered that.
No, I feel like lots of it has changed. Like, a lot of people didn't even know respiratory therapists existed before COVID even. And to me, I thought masks would be the new norm, and we've kind of changed that now, which I'm shocked by, which I'm fine with. It's just, I thought we would have to wear masks forever, and then shortage of supplies. Like, we kind of keep ahead of supplies now, just in case, because you never know what's going to happen. So there's just been different things like that I think we're more prepared for. I think that's probably the biggest change. And then the teamwork, there's definitely a lot more teamwork, because we rely on each other. I mean, even for just emotional support. So I think that's probably how our careers changed.
Yeah, I can't imagine what it was like being a healthcare provider during that time. I mean, it was, there were so many people constantly in and out of the hospital. It was just, wow. I mean, thank you for
Yeah.
for, helping during all that. I mean, it sounds like it took quite a toll on all of you. So we appreciate that. We really do. Yeah, they were tough times, most definitely.
Yeah.
So my next question is, what part of your career do you like best?
I definitely like patient care, just getting to know people. ICU and ER is definitely my passion. So, but I also worked on the long-term acute care hospital for a while. So that's patients that are going to be here for a while. Maybe they need antibiotics for long periods of time. So on that floor, I got used to doing tracheostomies. So patients that have the holes in their neck. But my most favorite thing, I think, about that, so if they have a tracheostomy, they're not able to talk, because whenever we talk, we exhale, and it goes through our vocal cords. So when you have a trach, you're not able to exhale through your vocal cords because you're exhaling through that hole. But once patients are stable, and usually they haven't been able to speak for a long time, but that's my favorite thing, is we use speaking valves. So we have different tools that we can use on patients once they're better, and just allowing patients to talk with those speaking valves is my most favorite thing, because it's awesome. People I mean, just, they always want to call their families or something like that. And it's just an awesome thing to see because we're letting them be human again, I feel like. So that's one of my most favorite things. It's pretty awesome. It's indescribable, really. I wish I could describe it to you guys. But it's cool to see patients that like that.
Yeah. Yeah, I definitely agree. That does seem like something that would be kind of rewarding. Actually, during our last career chat, when we asked this question, or maybe it was a similar question, but it was something like this, and all three of them answered that one of their favorite parts was, because we interviewed counselors, and they said that their favorite parts was watching their patients and clients reach their milestones and watching them grow and kind of, either graduate out of therapy or reach this goal or do these things. They said that it was very rewarding to see that happen, to be able to be a part of that, and to know that they took part in that and were able to help with it. So, I feel like, after hearing from you, that's probably a pretty common thing amongst healthcare providers, is being able to see the milestones with your patients. So yeah,
Yeah, all your hard work is paid off.
Oh yeah, definitely.
Yeah.
And so with that, my next question is, what part of your career do you dislike?
Definitely death. I've seen a lot of death. As I mentioned before, we help with intubation. So when patients can't breathe and we have to put them on life support, we put the tube in. But the opposite of that is we also take the tube out. And sometimes we do terminal extubations, so we know that the patients aren't going to survive. So that's definitely the hardest thing. But even little ones, we've seen death, and that's the worst part, just being right there and not being able to do anything to change it. That's the worst.
Yeah, Melissa, I had a question in regards to that. When you're assigned to patients and of different ages, do you have to have a certification to care for different ages with patients, or once you are a certified respiratory therapist, can you care for all ages?
We can care for all ages. We do have specialties, so you can take like adult critical care specialty. One of them is neonatal practitioner specialty. So you can get your specialty, but you don't have to. But we do have to keep like NRP, PALS, all those ACLS and all those things, but those are requirements. So we have to have those.
Thank you.
Yeah, thank you for sharing that. I really can't imagine how hard it must be to, to be there during those. So yeah, thank you for taking on a role that, is quite difficult at times. It's very helpful, very
Thank you.
very something to definitely appreciate. So the next question before I hand it back to Rowida is, how is your work and life balance? What do you do to maintain the balance between your work life and your personal life? Just things like that.
So we do 12-hour shifts. We work 6A to 6:30 P, or the opposite, 6P to 6:30 A. So that with that, we have more days off. So we have 4 days off during the week. So that makes it a lot easier too. I mean, those days that you work, they are definitely long days, and you do have to have an outlet for all your frustrations and anxiety like anyone else. But I think that the 12-hour shifts help with work-life balance because you have all that time off I mean, you work 3 days and then you have 4 off, or even if you worked an extra, you have a lot of time off. So we do have to do holidays and weekends, but it all evens out in the end. So I think that's the biggest thing. My husband's a fireman, so he does 24-hour shifts. So I like to do the days he works too. So then we have more days off together. So that's nice.
Yeah. I mean, it's good that you're able to work things out with your schedule and you know, be able to balance things out. I did have another question kind of separate from that. What is it like working like a 12-hour shift in a hospital?
It's kind
I
of
just, you know,
exhausting. Yeah. Because I mean, you're critically thinking a lot. So I always go to bed early, and my husband's always like, it's so early, but I'm so tired and you have to be there early. So
Mhm.
it's awesome. Right now I'm doing 5 days a week, but I prefer 12-hour shifts because I mean, I think probably because of the time off. Um, so it can be physically exhausting just because, especially if you have ER, because you're all over the place. But I mean, it was my favorite thing. I think a lot of people like it better even. So those days that you work, it is physically exhausting, but I always go to bed. I'm working, sleeping, working, sleeping, working, and then I'm off. So it's awesome.
Mhm.
I love that part. But
Yeah.
yeah.
Well, that's good. I'm glad that you kind of have that time in your schedule to be able to, have days off and
Yeah.
uh, have breaks from things. That's good.
Mhm.
And with that, I will hand it back to Ryder to ask the next few questions.
Okay.
Yep. And so a lot of the students we have here today, well, they're students. And so it's kind of something that I'm sure all of us are curious about, and that is your educational journey. Can you talk to us a little bit about that and what kinds of classes you took during high school or undergrad to get to where you are? I know you said you kind of had the reverse path. So
Mhm.
can you elaborate a little bit about that and how that worked for you?
Yeah, so my bachelor's did help. I actually did a 2-year program, so it was an accelerated program. But Missouri Western did just start a program, which is nice. But there is a lot of math and science, so there's a lot of equations and respiratory and that we have to know, which I love. I like math and science, so that wasn't a problem for me. But some people have said they wouldn't have done it if they would have known that there was so much math in it. But like microbiology, anatomy and physiology, a lot of high schools offer dual credits, which I did take advanced science classes in high school, but I didn't get dual credits for them. So I would recommend that, definitely doing as much dual credits as you can. So, and scoring, you do have to score high enough in those classes also to get into the programs. But microbiology, anatomy and physiology, advanced math, um, just those kinds of things. When you do an advanced programs like Concord or Kansas City, Kansas, they don't really do like set classes. So a lot of them are like 10 weeks of respiratory 101, 10 weeks of respiratory 201, and they kind of incorporate all of it in that. So my bachelor's was different because I took quant and micro and all of those things. But in respiratory school, when I went to Concord, it was all lumped into the program. So, but I would
Was
definitely say like
Sorry,
advanced.
go,
No, go ahead. Sorry.
no, sorry, I didn't mean to interrupt you. I thought that you were
No,
done.
you're fine.
Concord, which school is that?
It's in
Um,
Kansas City. It's on Broadway.
Concord Career College, right? Is that what it's called?
Yeah.
That's where I plan on going. I think that's kind of
Oh,
cool that you went there too. They have an advanced physical therapy assistance degree, and as I mentioned earlier, I plan on doing that.
mhm.
So I was looking into their program. So I think that's kind of cool that you went there too.
A lot of therapists in the department did. My daughter is actually a therapist also, and she went to Kansas City, Kansas Community College. So
Cool.
it's just, they're all a little bit different, but I mean, and getting a bachelor's helps you with advancement so you can do management and things like that. But just a 2-year program is enough to, I mean, start off working, and we hire also as students. So we'll hire you while you're in the program and doing clinicals.
Yeah, that sounds very cool. I mean, accelerated programs, they definitely have their benefits.
Yeah.
Fast tracking, it's kind of a great way to get into your career early and start doing what you love.
Mhm.
So I'm really glad you shared that. And so speaking again, on the topic of education, can you talk about, or do you have to complete any continuing education to maintain your license? And if so, how often and what kind of courses do you have to go through and how do you take those tests, basically?
So to maintain your Missouri license, you have to have 24 CEUs or continuing education credits every 2 years. 12 of them have to be live or traditional, which means you can attend a seminar or do webinars or things like that. And then 12 can be non-traditional or self-directed. So you could just do a lot of different websites offer CEUs for different things. So 1 hour of education is 1 CEU. Like ACLS, which is Advanced Cardiac Life Support, that's 6 CEUs. So you have to have that every 2 years anyway. And there's a lot of conferences. Tantera does a respiratory conference every year, and you can get a lot of your CEUs there. But the National Board of Respiratory Care requires 30 CEUs every 5 years. So you have to keep those too. And that'll, I mean, your 24 will get you the 30 in the every 5 years for the national. But different credentials that you can get: advanced adult cardiac or adult critical care specialty, you can get them that way. Just different, the National Board for Respiratory Care has different tests you can take to get them. But yeah, we have to keep up on our CEUs for sure.
Yeah, I think it's great that you mentioned that because careers in healthcare, they're definitely ongoing with the education, as healthcare is always changing and we're always learning new things. So it's important to go back and review the material that you once learned and learn the new discoveries that have also been found. So thanks for sharing that.
Yeah.
Now, this question, it's interesting, but it's a curious one that we always like to ask the professionals that we bring on here. And that is, if you could go back and do one thing differently, what would it be? And why?
I probably, well, when I was in high school, they didn't really tell us a lot about all the careers. So I probably would have done respiratory right out of high school and been done by the time I was 20. So instead, I was 28 when I started, and just because it was a quick program and I could have started working. And then if I wanted to go back and do more, I could have. So I could have been an anesthesiologist or a CRNA, any of those things. And that's probably what I would have changed, is just starting it sooner and then maybe going back and advancing in something like that. Anesthesia assistant, which I can always still do that. It's just different once your student loans are paid and going back, starting over. It's always harder, but yeah. And I always said once my kids were out of school, which they all are now, then I would go back, but I don't know that I will at this point. I'm happy where I am and I love what I do. So
Yeah,
but
I mean, sorry.
I encourage increasing education for sure.
Yeah. Thank you for sharing that. I mean, it's definitely easy to look back and say, hey, I could have done this differently. But, that's just part of life. Like you said, not everything goes according to plan. And what's important is that you're happy where you are right now.
Yeah.
And I think that is a very valuable thing to just take into account
Yeah.
for us as young people, but also for anybody that is, going through life.
Mhm.
So the next question I have before I pass it over to Gibby again is, what are some soft skills that you believe are vital to this career?
I would definitely say critical thinking, adapting to change for sure, and staying calm in stressful situations. That's a big thing. And a lot of people I think I don't know if I could do it because it's kind of stressful, but you'd surprise yourself. Like, of course, I was afraid of a lot of things when I started, but I think you'd be surprised at what you'd be able to do. But keep good communication and be reliable, because that's definitely the one of the big thing, because there's only a certain amount of us here for a day, and every patient in the hospital has to be taken care of. So if we're short, or if someone calls in or something just for fun, I mean, it's different if you're sick, but it affects all of us, and it ultimately affects the patients. So I'm a big advocate of patient care and always doing what's best for the patient. So I think reliability and definitely critical thinking skills would be
Yeah. Those are all very important skills to have, and I totally agree with you. And now I just want to ask a pop-up question out of curiosity. So, which soft skill would you say you do best at, and which one do you struggle with the most? And for the one that you struggle with the most, what do you do to work on it and improve it?
I think probably the one would be communicating, like communicating clearly. I've definitely worked on that. I don't like public speaking or anything like that, but like in stressful situations, you have to have good communication and clear, closed loop communication. And that's one that I've probably struggled with, and just practicing and being aware of it is probably how I've helped it improve. But even physicians, like communicating with physicians, at first that's intimidating, but now they're another coworker. And like, we have an awesome group of pulmonary docs and physicians anyway. So now it's just kind of easy to communicate with them, I would say. What was the other question? The hardest one, and then what was the other one?
Yeah, and what do you do to improve the skill that you struggle with?
Oh, yeah, just practicing at it and being aware of needing to work at it. That's probably.
I think self-awareness is definitely important. Just the ability to recognize that, hey, I struggle with this, I need to work on this.
Mhm.
And then that's where the improvement really starts, once you recognize that this is where you need to work on. So I'm really glad that you shared that with us.
Thank you.
Now the next question will be asked by Gibby.
Okay.
Cool. All right. So the next question is kind of similar to the one that Roida just asked. It is, what are some hard skills you believe are vital to this career? And I will add in the same thing that she did. Like, what hard skills are you good at? And then what one or ones could you improve on? And what do you do to improve them?
So definitely science and math skills, like I said before, because there are so many equations. Problem solving skills, I would say, definitely have good problem solving skills. Pay attention to details, because you'll get a call that this patient's oxygen is dropping or something like that, and it can be something as simple as it's plugged into the air instead of the oxygen, so the patient's just getting air, they're not getting any extra oxygen. So I would say look at the entire picture and pay attention to the details, because that could be the key to improving a patient's outcome. And then having good people skills, like get to know your patients. Like, they love to talk, and just asking them questions and getting to know them, just having good people skills, I think would be one of the good hard skills. That's probably one that I did struggle with also, would be the people skills, just because I'm kind of shy normally, but just learning how to interact with people. And sometimes all you have to do is ask them how their day is. It starts with a simple question, and when they're here, sometimes they don't have visitors. Sometimes this is the worst time of their life, and everyone has a story, and it's just awesome to hear those stories sometimes. But that was probably the one I struggled with originally and have improved on, just because some people don't. I'd just say you'd be surprised at how much what people's stories are, because it's pretty amazing.
Yeah, I believe it. Definitely. thank you for sharing. I
Yeah.
appreciate it.
No problem.
My next question is, okay, sorry, just like went blank for a second. Okay, here we go. What opportunities exist for advancement in this profession? Like, could you get promoted or specialized or things like that?
So charge therapist, that would probably be the first promotion. That's kind of a promotion because you're in charge of the shift. And then educator, you could be clinical education. We have associate directors here, and then you could be the director or management. And from there, you would just advance and farther up the management ladder, I guess, and be like a service leader or anything like that. So that would be the advancement, I would say. And then that we do have like specialties like the neonatal and adult critical care specialties. So that's cool.
Cool. Well, that's good that there's opportunities to move up a little bit. That's always a good thing to
Yeah.
keep in mind. So my next question is, what advice do you have for students seeking a career in healthcare or in your specific career? Yeah, so sorry.
No, that's good.
I'm not my brain's going all over the place. Sorry. What advice do you have for students seeking a career in healthcare or a career in what you do?
Okay. I would say first and foremost, be careful what you put on social media. Like your entire life doesn't have to be aired. And even if you delete something, it can come back to haunt you at any time. So I would definitely say that first and foremost would just watch your social media because I mean, you should do that anyway. It can be dangerous out there. But I would say job shadow every career that you think you might like, not just one specific thing. Go shadow multiple things and see what you really want to do. Do your research. List the pros and cons of each one, what you might like, what you don't like. I would say doing dual credits in high school, like a lot of times you can do a CNA program. Some people haven't had any kind of exposure to the hospital. If you can volunteer in the hospital, just getting some kind of exposure in the hospital can really tell you if that's something you want to pursue. I would say tattoos are allowed, but body piercings are not. So watch that. I mean, Mosaic accepts ear piercing, and tattoos are cool. Just be careful what you do with them, because obviously not on the face or things like that. And then a lot of times I would say dress appropriate for interviews, because a lot of times we have kids come in and maybe they're not ever told to be business casual or things like that, but that's something that we always look at. And then if you do clinicals and stuff here, those really are interviews. We're watching you as you're a student. And so just be on your best behavior and be punctual, and because I mean, it could affect whether you have a job or not. So I'd say that would be my advice.
Yeah, that's some excellent advice. Thank you. I think that all of us can use that. And yes, I definitely agree on the being careful about social media, being careful with your appearance, and also dress. When I I took a careers class my sophomore year. It was really more of like a little prepping you for careers and types of things like that. And one of the very first things they taught us was, when you go to a job interview, depending on where you go, please don't dress casually like you would on the street. Make sure that you're dressed appropriately for an interview, especially if you're going somewhere that's more of a professional. Like if you're going to go to a job interview for a law firm, then you're not going to wear blue jeans and cowboy boots. It's just
Right.
because it's not professional. If you're going to go for a medical career, you're not going to do that. You're going to wear business casual. So I mean, I think that is some excellent advice, and that is also advice that I've I've been given before. And the dual credit thing, definitely. I can attest to that as somebody who is taking dual credit classes and who did not take a class for dual credit last year. I just took it regularly and I didn't do it for dual credit, and I wish that I had. So
Yeah.
I can second that advice. Definitely take any dual credits that you can. They will be very helpful to you in the future.
Yes.
So
Mhm.
I can definitely second that. And so our last question for you is, do you have any last thoughts that you'd like to share as we wrap up the chat? Anything that we didn't cover that maybe you would like to discuss, anything. And if any of you have questions, then you're welcome to ask those as well. But just,
Yeah.
any last like follow-ups.
I would just say research. Job shadow for sure, because you never know if it's something that you really want to do until you follow us around and see if that's something. And it's more than just a paycheck. Like, this is the rest of your life. So you have to do something that you love. And any career in healthcare, you have to have a passion for those patients, because we're taking care of them at their sickest, at the worst times of their lives, even their families. We have a part in their lives. So make sure it's something that you're doing because you love it and not just because of the paycheck, because life's too short to do a job day in and day out that you hate just because you want to get paid good money. But do research for sure. There's so many fields out there.
Yeah, cool. Yeah, I've done extensive research on different
Yeah.
careers and things. I've switched my career path, my major, maybe like 5 times since getting into high school. So
Yeah.
it's there's definitely a lot of options. So I second that. Thank you for coming on and doing this with us, and for sharing your experiences and answering our questions. We really do appreciate it. And just thank you as a healthcare provider for doing that for us. We do appreciate it. And with that, I will give the mic back to Taylor for any last comments.
Thank you for having me. I've enjoyed talking to you guys.
Yeah. I just want to thank you as well. Thanks for joining us. I know sometimes coming in on the evening, especially after a long day at work, as you just explained, can be kind of tough and taxing. So we greatly appreciate you for taking your time out of your day to do this for us. Thank you, Gibby and Roida, as well. You did a wonderful job. Thank you for taking this on again. Anyone else who would like to join our next virtual chat, it will be November 21st, and we'll be highlighting medical lab science. So more information on that will be on our website as well. So please stay in contact with us. If you're wanting to job shadow, like Melissa had said, please reach out to us as well. You can reach us at northwestmissouriahec.org, or just reach out to me directly with Taylor Danbury at Northwest Missouri AHEC, and we can get you scheduled for job shadowing at Mosaic. So if there's no further questions, then I'll go ahead and close up the chat and our Zoom session. But if there is, we're more than welcome to speak up now, and I'm sure Melissa can answer those for you. All right, looks like everybody's good. So we'll go ahead and end it. Again, thank you so much, Melissa, and everyone else. I will talk to you later.
Thank you.
Bye-bye.
Bye.